Dr. Henry. Ontario's provincial health officer is now asking parents in their 4 hardest hit regions, and that includes Toronto and Ottawa, not to send their kids trick-or-treating. What do you think of that decision from your colleague in Ontario? And if cases continue to grow here leading up to Halloween, could you envision making that same recommendation in the really hard-hit regions here, like Keith was just talking about in Fraser South?
You know, I'm not going to comment. We are, as I've said all along, we're all experiencing our own pandemic. And here in BC, we've managed to relatively control our community spread. And really, when we think about the trick-or-treating, it's outside, it's a relatively low-risk environment, and there are many innovative things that I've been hearing from my friends and from parents around the province about things that we can do to do that safely. I think it's important for us to remember that ceremonies are things that children remember as well, and that this one will be different, and it needs to be small, we need to have distancing, and we need to really, really respect that some people don't want to play this year, and they don't want to have people coming to their house. And I think that is something that's important. And I would encourage parents across the province to look at having small gatherings in your home, making sure you connect with people in your community about who does want to have children come to their house, and do it in a very small way, in a limited way, and do some of the other innovative things. One of my parent friends was talking about either a tube or having a little line with clips that they can put little packages down to children at a distance. So I think there's lots of things that we can do to make it safe and keep it outside and keep it small.
Shannon, do you have a follow-up?
Yeah, Ontario's provincial health officer's worries are that kids reaching into candy bowls, comparing and sharing treats as they often do while trick-or-treating is simply too dangerous. Do you not agree with him? And if not, can you describe a safe way that would work for both the people, the parents handing out candy at front doors, and also for the kids who are the ones doing the trick-or-treating? How would it work safely if you don't agree with the Ontario provincial health officer's concerns that it's just too unsafe?
You know, I haven't heard what they've been talking about, but what we know is that this virus is spread between people when they're in close contact through respiratory droplets. And so as long as children are washing their hands, we have single packaged candies, so this is not the time to do the homemade candy apples, but to have things that are prepackaged that children can receive in individual packets so they're not digging into a common bowl, and maintaining distances. And as I say, there's lots of innovative ways to do that. But, you know, this is not the year where we're going to have hundreds of kids going to hundreds of houses in large groups. That can't happen this year. This has to be, you know, Halloween in the time of a pandemic. And for many families, that'll mean staying at home and maybe having a candy hunt in the house and watching a scary movie. And that's fine. That's okay too.